It's been in the news recently. We can get alertness, we can get arousal, we can get better performance just by taking a whiff. And what's the whiff of? Smelling salts. Smelling salts. Do they work? And if so, why has the NFL banned them? Well, let's talk about that.
Warning. The following presentation contains information that might contradict what you have previously heard, or believed to be true, about how the human body works, and contains material that is not suitable for closed-minded individuals. Enjoy!
So we start looking at smelling salts, start looking at the use of smelling salts. Let's take a quick look at the history of it. Ammonia salts or abrasive salts were classically used to treat fainting spells, particularly fainting spells within women. As we see within Rembrandt's portrait of the unconscious patient, it was used by physicians in an attempt to alert or bring back, in terms of arousal, a patient that has fainted, what we refer to as syncope. And what were these treatments for? Well, they were for hypotensive syncope, low blood pressure, where the use of the abrasive salt would trigger an increase in blood pressure, and by increasing blood pressure would help alleviate the hypotensive syncope. An apneic syncope, or a respiratory distress and disease issue, where the use of the abrasive salt would trigger a breathing response in an attempt to clear out nasal passages, in an attempt to clear out respiratory passages based off of the abrasiveness of the odorant coming away from the ammonia salts. It has gone from doing that to being used by athletes. And why are athletes using it? Athletes are using it based off the presumed effect it's going to have in terms of providing a performance enhancement. Everything that athletes do is always about performance enhancements. We have to remember, whenever we start looking at any of the things that athletes are going to take for some sort of benefit to them. How's it going to do this? It's going to do that by increasing alertness or by providing a quick jolt of energy, as everybody likes to call it. How does it go about doing that? What is the assumption for how these are going to work? Well, when we start to breathe in the smelling salts, that odorant is going to trigger a respiratory response. That respiratory response is an attempt to clear out whatever is causing the irritation within the nasal passage, within the upper respiratory tract, which is going to lead to oxygenation of the brain, which is going to lead to the increased alertness or the increase of arousal, or the alleviation of the syncope as was used in the treatments in the past. The other assumption that's going to come into play here is the assumption that, once again, this odorant is going to trigger a response. In this case here, the response is going to come from the amygdala triggering an alarm phase. That alarm phase is what's going to lead to, in terms of Solei's gas response, a sympathetic nervous system response. That sympathetic nervous system response is going to cause fight or flight to take place. That fight or flight is going to trigger a host of various responses that we're going to see, all based off of positive feedback triggering additional responses to come into play. What are those additional responses that are going to come into play? Well, we're going to have a whole host of various indications where we're going to increase production of ATP, we're going to increase freeing up of glucose, we're going to see a spike in blood glucose, we're going to see an increase in lipolysis, a breakdown of lipids, we're going to see dilation of pupils, we're going to see a dilation of airways, all in an attempt to increase oxygenation, increase sensory input, increase fuel utilization or fuel availability for the cells to do what the cells need to do in order to overcome whatever is triggering that fight or flight response. In this case here, the smelling salts. This is where we're going to get a response here that is also going to lead to a cardiac drift, cardiac shift episode, which is going to increase heart rate and increase blood pressure due to the changes that we see in the sympathetic nervous system responses and the hormones that are coming into play here. We're going to see changes in blood flow throughout the body, where we're going to see an increase of blood flow going to the skeletal muscles, increase of blood flow going to the heart, increase of blood flow going to the liver, the adipose tissue, the skin, as well as to the brain. We're going to see a reduction in blood flow going into the kidneys as well into the gastrointestinal tract, all in an attempt to make sure that we're getting blood going to where blood needs to go in order to overcome the stress of the situation. In this case here, the smelling salts triggering this alarm phase. The trigger is going to stimulate what could be perceived as a stress, as a threat to the body, which is going to cause the sympathetic response to take place, and the sympathetic response leading to the alarm. It's the alarm that's going to cause or lead to what we expect to see in terms of that increased alertness. In this case here, what's happening is that we get the sense of a stressor coming from that smelling salt, which is going to lead to this outward flow within the alarm phase, which is going to increase norepinephrine and epinephrine, noradrenaline or adrenaline, which is also going to trigger an activation response within the limbic system. We're going to see an increased rate of depolarization. We're going to see increase of blood pressure, increase of heart rate, increase of respiratory rate, increase of skeletal muscle force, increase of activation of our active side of neurotransmitters within the cerebral cortex. All this is going to lead to increased alertness in terms of responses to stresses. This is going to lead to increase of contractile strengths. This is going to lead to increase of neural conductions. The other thing we start seeing is a decrease in hippocampal activity and increase in amygdala activity. This leads to an increase of attentiveness, but a reduction in focus, as well as a change in recall and recollection. This all is going to feed within a positive feedback loop where we're going to continue to have this going on as long as that stress is taking place. This is going to lead to an increase of reactivity and increase of reflexivity, which may not be what we actually want in terms of having increased athletic performance. So that's the physiological effect of having the stress response. How is that going to take us from our presumed effects to the actual effects? What do we actually see in terms of performance gains from using these ammonia inhalants, from using smelling salts? Well, if we look at it, there does not seem to be much of a benefit from using the smelling salts, whether it's in strength or whether it's in reaction time. There are some small differences, but the differences are not significantly different when we start looking at smelling salts versus non-smelling salts. We look at our control versus our test groups. If we start looking at it in terms of the preponderance of evidence, the evidence demonstrates that there is an ergogenic benefit to using the ammonia inhalants, but only during repeated bouts of high intensity exercise. What's that mean? That means when we start looking at reaction time, there does not seem to be an indication for improved reaction times. If we start looking at anaerobic power and anaerobic performance, there does not seem to be an indication for improvements in either anaerobic threshold or in terms of anaerobic performance. There is an exception to that, though. There is one study and only one study that was published in Strength Conditioning Journal that showed that for football players who took an ammonia inhalant had an increased power output, both in terms of the change in peak power as well as the change in mean power, relative to not taking the ammonia inhalant, the smelling salts, after doing a simulated football game. And that's the key here, simulated football game. So we see that there really isn't much in terms of benefit to using this. So what's this mean? It means that we're probably looking at a placebo effect, probably looking at something that is acting as a placebo. That is where we are seeing something that is very similar to what we see from the control group without having much benefit in terms of performance gains from the smelling salts. If it's not a placebo effect, that means that we're looking at a Hawthorne effect. That is, the antidotes make the athletes believe it's working and act in such a way that it makes it seem like it's working, even though it's not really working. We start looking at the subjective responses that we get from the athletes, because the athletes are the ones that are telling us this. If we look at the empirical evidence, we don't see much benefit. That means that we're looking at observer bias or a faulty causation. We're attributing positive outcomes to the use of the substance and negative outcomes to something else. We're saying that we get a performance benefit because of the smelling salts, but if we happen to have a reduction in performance, it's not because of the smelling salts, it's because of something else that's happened during the contest. So why is the NFL banning it? Well, they're worried that's going to mask concussions. They're worried it's going to somehow mask the impacts that we have in terms of head injuries coming away from the game. But does it? Not really. It doesn't really cause an impact on what we see. So why is it banning it? What is the purpose of it? Part of it is because there's no indication for the use of the inhalants in acute treatments for head injury. Part of it is because we can have a potential exacerbation of injury due to what's referred to as an odorant withdrawal reflex. That is where we have a sudden, rapid movement of the head away from the odorant, away from the smelling salt, which can cause or even exacerbate injuries that have already taken place. The assumption that's being made here is that we're going to trigger the assumption here that the NFL is making about the use of the smelling salts. That is why it is banning the smelling salts. The assumption here is that The trigger of the alarm response is going to allow the athlete to mask the concussion. That is the assumption that's being made, ignoring the fact that it is not part of a actual ethical treatment for head injuries. It's ignoring the competitive nature of the athlete and the intrinsic drive that the athletes have to stay on the field. It's also ignoring all of the other things that are coming into play that cannot be masked, such as headaches, confusion, dizziness, memory loss, difficulty concentrating or making decisions, slowed reaction time, nausea, vomiting, sensitivity to light and noise, neck pain, blurred or double vision, irritability, ringing in the ears, weakness or numbing in the arms or legs. The other thing that this is ignoring is the underlying cause for a number of the issues within head trauma for athletes is not because of actual concussions, it's because of subconcussive trauma that's taking place that is compounded by changes in hydration that is seen with the game. Where when we have dehydration taking place, there's a reduction in the pliability of all of the neurons within the cerebral cortex, within the brain. There's a reduction in the pliability of the connective tissue that is supporting the brain that leads to a lot of concussion issues that is independent of actually suffering a concussion. And so we're ignoring those factors here when we start looking at and trying to label the issue of smelling salts as the thing that needs to be banned. There is no evidence to support the use of smelling salts for improved performance. It is not a recommended use for head trauma. So why are they banning it? Probably because it doesn't actually do anything outside of that Hawthorne effect for the athletes. Well, thanks for watching. Thanks for listening. Hope we get a little bit out of the conversation. Please make sure to follow us here on YouTube as well as on the podcast, Substack, as well as quick takes on Instagram and Threads. If you like what I'm putting out there, please make sure you have subscribed to follow us. Please make sure you're sharing out with all of your friends and family.